So essentially, organ procurement is a procedure that can be done in many hospitals across the nation. It is after a family member, or more importantly, the patient has their wishes to be an organ donor. And sometimes this procurement of an organ can take place at a hospital. Sometimes it takes place at the procurement center. It just kind of depends on a lot of variables and things that come up. But organ procurements can kind of be a taboo topic with some people. And I thought, if a lot of people are having these problems, I want to kind of put that to bed. Like, it doesn't have to be a bad relationship. So I worked with our local procurement organization, Mid-America Transplant in St. Louis, to kind of come up with what exactly does what does an OR nurse need to know? What is actually the procurement team? Who are these people that are coming into your facility? I kind of took what I used to train new nurses in our OR to come do procurements and kind of put it all together. An OR nurse, what they really need to remember during procurement is you still are an advocate for your patient. We know we work in tandem with this procurement team. So I need the information I need for them, like who's in the room, sometimes you have multiple teams from around the country coming. So, like I said in my presentation, you could have one patient and the heart's staying in St. Louis, the lungs are going to Pittsburgh, and, the kidneys are going to Dallas, for example. But the number one thing I always stress, especially to like the new nurses I'm orientating, and that I stressed in this presentation, is we're still an advocate for the patient. So we need to know, what are we procuring? So essentially what I would like people to take away from the presentation is that you leave with a greater knowledge about what procurement and the donation process is. And it's an area for OR nurses where we really can make a difference and honor somebody's life. But the main takeaway I'd like people to know is, and I'm going to quote from a recent AORN journal article, there was a study in Sweden that talked to nurses about their feelings and emotions when it comes to procurement, and I feel like this sums it up really well. It is my core mission to take care of the patient in a dignified way, respecting the human and realizing that, though tragic, I am being a part of something amazing at the same time.